Honorable Chairperson. At a very challenging time in the history of our country, including complex geopolitical events of recent days, I believe this House is eager to hear how we plan to navigate through these complexities. Basically, we have got three main objectives in this budget. Objective number one is to lay a strong foundation in preparation of improvement of public health system of our country, to lay the ground for the national health insurance. And there are people, of course, who believe that we have no plans at all, or we have got no inclination to try and see if we can improve, especially the infrastructure in public health services. We want them to listen very attentively today. Secondly, our objective is to lay a strong foundation and to embark on the journey towards elimination of certain diseases, especially communicable diseases, but not leaving behind non-communicable diseases. Honorable Chair, one of the mistakes we do in healthcare, and I hear a lot about it even from leaders, is to believe that healthcare is only inside the hospital and that certain diseases are here forever and they are here to stay. And we want to differ strongly with that. Our third objective is to try and implement serious reforms in the private health sector. Please ignore those who want us to believe that there is nothing to fix there. We only have to deal with the mess in public health, as they always tell us. Let me come to this issue of health infrastructure. One of the biggest problems that public health system encountered and was severely criticized for is the health infrastructure. The broadside the sector received is exemplified by the encounter at Helen Joseph Hospital in Gauteng. The complainant lodged to the health ombudsman 7 complaints. 5 of them were dismissed because they said there's no problem there. The 2 that were upheld by the health ombudsman is infrastructure and human resources. The 5 that were dismissed as unfounded is clinical protocols, meaning we have got people who have got enough skill, who have got enough knowledge, who are doing the correct things, and they are just being let down by lack of infrastructure. The extreme overcrowding in our public health facilities is caused by rapid population growth and rapid urbanization. Please remember that the public health system is utilized by 86% of South Africa's population, and none of them are in this house today, except myself. You throw in a mix of our neighboring countries, and honorable members, if we do nothing about this situation, I can assure you the scenes you see on TV of pregnant women sleeping on floors and on chairs will be the order of the day, unfortunately. We have got clear evidence of this in Doranginza Hospital, which is always on TV for wrong reasons. Even the public protector went there on her own and agreed with us and said that problem, which people believe is just a problem of management, is a problem of overcrowding. And even the public protector instructed, we need to build new district hospitals in that area. We need to urgently add many more if we are to make impact. So we are planning a new hospital in Diepsloot District Hospital, new hospital in El Dorado Park, new hospital in Soshanguve, new hospital in Dobsonville or Meadowlands, and a hospital in what is called the Holomisa settlement. The reason that we are doing so, honorable members, is that if we don't do so, we are going to end in the situation which ESCOM found itself in today. When they were told some years back to build more power stations and they were nowhere put out, our hospital infrastructure is leading to that. I want honorable members to understand the huge difference between private hospitals and public hospitals is infrastructure, as I've said, but also equipment and other facilities. Treasury told us they want to move away from austerity measures in this budget, and that was the beginning. Hence, we've been given 6.7 billion rand this year, and we'll get another next year and the third year, so that we try and get out of this austerity. What have we decided to do with this money? We met with all our 4 provinces and agreed that with this 6.7 billion, we need to hire 1,200 doctors, 200 nurses, and 250 other healthcare professionals. This will cost us 1.7 billion. We also need to acquire 1.4 million articles to make public hospitals hospitable, because that's where our weakness is. We're not hospitable. We will buy new beds, mattresses, pressure mattresses, bassinet for babies, and new hospital linen and towels. Bassinet for babies, members may remember what we once saw on TV, which was heartbreaking. Children being put in cardboard boxes in Northwest because they had no bassinet. We are ordering 76,000 of them for the whole country. This will cost 1.3 billion overall. We also want to employ permanently community health workers who have been in the system for close to 2 decades, some of them for even more than that, and we want to employ 27,000 of them. Finally, honorable members, please accept our allocation of 270,842,000. Please accept it, honorable members, and I thank you for your attention. But I want to correct something. Governments never take a Hippocratic oath. It is taken by individual doctors as a covenant between the doctor and the patient. It does not have anything to do with government. I took an oath as an individual doctor, not because I belong to any government. I also want to correct the stats we have given about HIV. When you put this malevolence, this very bad picture, on the 10th of July, the UN AIDS came here to give a global report about HIV AIDS globally. They chose South Africa because we are being very successful. And the executive director of UN AIDS spoke well about what we are achieving. So where do you take your facts from? You're not an authority on HIV AIDS. This is the World Authority saying we are doing very well. So, ma'am, please, man, don't do such bad things to your own country. Honorable Duplessis, value for money. Let me tell you what is not value for money. It's the present system we are running. That's why I want to change it to NHI. It's not me who is saying so. The World Health Organization declared that in 2009, that we and the US are outliers because of the system we are running here. Professor Robert Yates of London School of Economics 2 months ago issued an article that South Africa must dump the US healthcare system because it's not good for us. What is meant by US healthcare system is where you spend a lot of money in health, but you don't get results. Because that money, the manner in which it's spent, won't give you results, which is what situation in South Africa. We are running 2 healthcare systems, one private, the other public. The private one heavily subsidized by this government, which is what we want to stop. All of you here, you are getting heavy subsidies from this government. Money that should be going to poor people is coming to take care of you and your families. But you don't see anything wrong with that. 51% of healthcare expenditure in this country goes to private health to support 14% of the population. And the remaining 86% must be supported by the remaining 49%. And you are asking me, let me tell you what we have done with this money, which is so little. Which is so little, by the way. It has delivered 1,060,000 babies every year versus 140,000 babies that are delivered with this huge money in the private sector. That's a fact. It is treating 94% of HIV positive people versus 6% treated by the private sector. It's treating 100% of TB versus 0% of private sector. It is paying for 98% of all childhood vaccines versus 2% only. And you say that's not value for money. It has reduced maternal mortality from 240 per 100,000 births to 109 in a short space of time. It has reduced children born HIV positive, from 70,000 in 2004 to only 634 in March this year. And you tell me this is not value for money because of PMTCT. I don't expect DA to support NHI, but I don't expect them to misinform. I don't expect them to support it. The facts are simple. The present system with medical aids covers 72% of the white population, but only 10% of the black population. Where is the money to cover you? Why do you think this money must cover you when it goes to cover the others? You say, where is the money? The present system covers 72% of the white population, but 10% of the black population only. And you expect us to keep quiet? Ach, nee, man, we can't.